Okay, my name is Diana Igwe, and I'm currently working at Long Catlis Road GP Surgery as the lead practice nurse and was specialising in diabetes. My career journey, it's been quite a bumpy ride because I used to be an accountant working in the city, but after I had my second child, due to me seeing how the midwives behaved in Medway Hospital, was really good, and I looked at them and I said, oh wow, they must love the job, they must love what they're doing. And I was tired of the commuting from Medway to London. I decided to train as a nurse. So I had my baby in June that year, 2005, and in September I was training to be a nurse in Medway campus at the university. I registered to do the Masters in Diabetes Studies. After I graduated from my nursing training, I took on a post as the rotation nurse, adult nurse, in where you have to spend 4 months at a time in every community settings. And I ended up, my last placement I remember was with the community diabetes team. And it was so good and very, very interesting. And I ended up having a job with them. That was in primary care. I left there and I went to work in a GP practice. But then at that time, the diabetes management of type 2s and even type 1s was not as it is now. So I had to leave because I wasn't able to manage them. Not enough time was being given. I had to leave, and I had various job roles. I worked in the prison service, and then I worked as a care home manager. And then I went back to the hospital as a diabetes specialist nurse. And I ended up being the transition nurse as years went by with the inpatient diabetes service at Darren Valley Hospital. But then because of this job that was available closer to home, I ended up taking this job here with the Long Catlis Road Surgery. The LEAD program is a leadership program. I would recommend that everybody that is in leadership do it, because although I've got a degree in business management, being in management and being a leader is completely different things. Because as the LEAD program, I got to realize that there was a lot that was missing, because being a leader is not about just managing people. It helps you to be that manager that everybody aspires to be. And it's not just in your career life, even in your home life, because I learned a lot of things: relationship with people, relationship with at work, at home, at every level. It taught us so much. I was privileged to be assigned a coach that we had during the duration of the course, and where you could speak to and hear out what you would have done. My role within the GP surgery is a lead role, because the lead and practice nurse. Because I used to be a practice nurse years and years ago, I decided to blend it in with my the diabetes role as well, being that I'm one of the first cohorts from NHS England to be awarded for the Advanced Nurse Practitioner's role through the e-portfolio route. So within the surgery, as I'm the lead, I manage the nursing staff, and I work within a team. So we have some advanced nurse practitioners here, we have the doctors, and we have the admin team. And I'm not only doing diabetes, my day is very varied, because I manage women's health and cardiovascular management as well, and sometimes I'm involved with immunization and vaccination. My role benefits the practice more so where diabetes is concerned, because having worked in the primary care and the secondary care, I'm better placed to know what exactly the patient needs. Waiting list for a diabetes patient to be seen and addressed in the hospital is a very long one. It's a very long wait. But me being in the GP practice, I met with so many pre-diabetes patients, and diabetic patients as well. And I'm able to, instead of them going to the hospital, where sometimes they have to wait long hours in A&E or being on a waiting list, for them to be assigned a date for them to come for their review, I'm able to do majority of the things in the GP practice. In the next couple of years, because I've been a diabetes nurse for 15 years now, I had a plan. I had a proposal that I made when I was working at Medway Hospital as the lead inpatient diabetes nurse, for where we go out and meet with them, and you deliver education, and you go where they are and talk about prevention of diabetes. And going forward, I would want to revisit that, where I'm making a proposal that most of the GP practice should have a specialist diabetes nurse, where I will be able to manage the type 2s in the community, because the GPs are initially seeing them before they make any referrals on. So if we're seeing them first and we're meeting their requirements and dealing with it, then secondary care will not be elongated with this kind of jobs that would have been dealt with, and so will be left for worst case scenarios.